Hello and a very warm welcome viewers. You're watching the Question Hour show from the Parliament House complex, the show where we bring all the important unstarred questions asked by the members of the upper house and the response given by the government. I'm Kriti Mishra and joining me is my colleague Rajat Kain.
Thanks Kriti and thanks to our viewers for watching this edition of Question Hour. Now, Question Hour is essential tool of parliamentary democracy where members get to question the government and government gets an opportunity to answer on those queries. Now, broadly speaking, there are three categories of questions: starred, unstarred and the short notice ones.
Absolutely, Rajat. Now, starred questions are those questions of which the answer is also given on the floor of the House, where the members can also ask supplementaries from the ministers. Whereas unstarred questions are those questions of which answers are given by the government in written format. And our show focuses on all the important unstarred questions asked by the members of the upper house during the 253rd session of the Rajya Sabha.
Well, how these questions are asked and how they are answered. Here is a small presentation. A member submits his or her questions at least 15 days before the office of Rajya Sabha chairman. The Rajya Sabha Secretariat chooses the questions to be answered through a draw of ballots. Separate ballots are held for starred and unstarred questions. The questions are scrutinized for admissibility under the current rules and precedents. Questions are disallowed if they are not in order. Advance copies of chosen questions are sent to ministry or departments concerned. The ministry concerns collect information to prepare the reply. The minister concerned reply to starred questions on the floor of the House and provides written answers to unstarred questions. Up to 160 unstarred questions are listed every day in a separate list.
Well, there you saw our presentation. Rajat, it's time to begin the Question Hour show. And the first question in this edition of the Question Hour show is from member Lieutenant General Dr. D.P. Watts, retired. And this question is to the Ministry of Health and Family Welfare. And the member has asked whether the government proposes to increase the expenditure of the states to address the shortcomings in our healthcare system.
A reply to this query was given by Minister of State for Health Ashwini Kumar Chaubey. The ministry in the reply says that as per the latest available National Health Accounts estimate, government health expenditure has increased from 1.15% of GDP in 2013-14 to 1.2% of GDP in 2016-17. The National Health Policy 2017 envisages raising government health expenditure to 2.5% of GDP in a time-bound manner. Further, National Health Policy 2017 also envisages that states should increase their health spending at least 8% of the budget, and two-thirds of such expenditure should be on primary care. Public health and hospital being a state subject, the primary responsibility to provide affordable healthcare facilities to people lies with the state government. The Government of India has taken several initiatives to provide affordable and quality healthcare facility to the people. These include National Health Mission is being implemented to supplement the efforts of the state and union territories to provide accessible, affordable and quality healthcare to all those who access public health facilities. The main programmatic components include health system strengthening, reproductive, maternal, neonatal, child and adolescent health, and the control of communicable and non-communicable disease. With the aim of improving the quality of care, the Ministry of Health is implementing national quality assurance standards for district hospitals and other health facilities. The government has already launched Ayushman Bharat in 2018, which aims to holistically address health, covering preventions, promotion and ambulatory care at primary, secondary and tertiary level by adopting a continuum of care approach. It has two components: Ayushman Bharat Health and Wellness Care, Ayushman Bharat, and Ayushman Bharat Pradhan Mantri Jan Arogya Yojana provides comprehensive primary health care by expanding and strengthening the existing reproductive, child health services and communicable disease services by including services related to non-communicable disease such as hypertension, diabetes, common cancer of oral, breast and cervix, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana provides health insurance cover up to 5 lakh per family per year to around 10.74 crore people and vulnerable families, nearly 50 crore individuals identified based on socio-economic caste census data. Under Free Drug Services Initiative, substantial funding is being given to states for provision of free drugs and setting up of systems for drug procurement, quality assurance, IT-based supply chain management system, training and grievance redressal mechanism. Free Diagnostic Service Initiative addresses the need of accessible and quality diagnostics at public health facilities. The ministry has launched operational guidelines on Free Diagnostic Service Initiative, which enables the states and union territories to provide essential diagnostic laboratory services and radiology services, teleradiology and CT scan services at their public health facilities. Under Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, quality medicines at affordable prices are provided to the masses through dedicated outlets called Pradhan Mantri Bharatiya Jan Aushadhi Kendra across the country.
And joining us on the Question Now show is Rajya Sabha MP, Lieutenant General Dr. D.P. Vats, retired. Sir, welcome to Rajya Sabha TV and thank you so much for joining us.
Thank you, Kriti.
So during the 253rd session of the Rajya Sabha, you'd asked a pertinent question about the proposal to increase the expenditure of the state governments on healthcare sector. How important is the issue, especially after the blow of the COVID-19 pandemic?
Now, complete world is in the thick of battle against COVID, and economies have taken a very bad hit. But at the same time, we have to fight this war. And taking cognizance of that India is disease capital of the world. But we are in the forefront of fighting the COVID also. For this, money is required and budget has to be increased. Now, as far as budget 2021-22 proposals are concerned, there is a substantial increase as compared to approximately 95,000 crore budget spent on health. I mean, including sanitation, including availability of potable water, in addition to COVID vaccination, research, Ayush and healthcare facilities. There is 137% increase in central budget, which is really substantial. And it is desired that states should also spend 8% of their GDP on health and family welfare, especially when we are facing a pandemic in the form of COVID-19. As far as spendings are concerned, I will like to apprise you. Some topics are there: availability of total allopathic doctors, Ayush doctors, dental doctors in India, their distribution of nurses. All these things are a matter of concern. There, at present, approximately there is 138 crore population of India, and for that 12 lakh registered medical doctors or allopathic doctors are there. Out of them 12%, 10 to 12% may be in administration, or they have migrated to the foreign countries, but their registration still persists, stays with the Indian Medical Council. Same way, there are 2 million nurses Now, amongst them also, by the end of 2030, we will be requiring 2 million doctors and 6 million nurses. There are around 2.5 lakh dental doctors in India, 8 lakh Ayush doctors also. But matter of concern is that their concentration is in big cities and cities, not in villages. Now, we cannot prevent them going out also. I am rather in favor of that export quality doctors should be allowed to go out, because they are a very big source of foreign exchange earnings like engineers. But we should produce more, and for production approximately there are now 531 medical colleges in India, half in public sector, half in private sector. 157 medical colleges are in the process of being established, and we have around 80,000 medical MBBS seats. They have been increased from 55,000 in last year, and with the addition of 157 medical colleges, we are in the process of meeting the demand for medical graduates. Here the states can take help from center and help in establishing medical colleges at those districts where there are no medical colleges. Like this, there are 157 districts out of 700 districts where there are no medical colleges, and there is a plan to open a medical college at every district headquarter or upgradation of district hospital to a medical college. India is a very good country. You see, as I mentioned in the beginning, that we are the disease capital of the world, and disease capital of the world means there is a lot of clinical material for the doctors to learn. In foreign countries, they are taught on simulators, on dummies, but in India, there are lot of patients. Patients get treated, doctors teach and learn, and for medical education, clinical workload, facility and faculty count. By passing National Medical Commission Act or by scrapping Medical Council of India, we have made the medical education easy and force multiplier. The stipulations for opening a medical college, for increasing the PG seats, for increasing the undergraduate seats, even for increasing the nursing seats, and for increasing the Ayush seats also, the stipulations have been relaxed. That is a big achievement, and states should come forward. Let them come on PPP mode, means they can avail this opportunity given by the National Medical Commission and Central Health Ministry to open a medical college to meet the rural requirement of doctors. Ideally speaking, as per the recommendations of WHO, one doctor is needed per 1,000 population, but all doctors combined in India, it accounts for 1,500 population per doctor, but actually it is not there. In villages, they are not there. That is the main thing where states can increase their budget for expansion and force multiplication or technical know-how multiplication in the form of medical education, thereby meeting the demand of comprehensive मेडिकल केयर और उपचार आपके द्वार. Now a big campaign is going on combating the COVID-19, and 35,000 crore rupees in this budget have been earmarked for COVID vaccination. We plan, second surge has come.
All right, sir, you made very valid points there. Thank you so much for joining us and speaking to us.
Well, moving on to next question that was asked by member Ramnath Thakur from Ministry of Skill Development. The member asked details of the skill development centers open across the country.
Well, under the Skill India mission, the government is implementing the Pradhan Mantri Kaushal Vikas Yojana, and there's a detailed response given by the MOS, Skill Development and Entrepreneurship, Mr. R.K. Singh. He goes on to say that Pradhan Mantri Kaushal Vikas Yojana does not mandate the establishment of training centers. However, accredited and affiliated training centers with more than 4-star rating are eligible for empanelment under Pradhan Mantri Kaushal Vikas Yojana 2.0. Under the process of affiliation of training center, the broad parameters, namely area of training infrastructure, availability of training tools or equipment, counselors, safety measures, and also other facilities are required to be met as per the laid down guidelines. Further, the scheme of Jan Shikshan Sansthan is being implemented through its institutional framework in the country with the objective to improve the occupational skills and technical knowledge of the non and neo-literate. The empanelments of the new JSS are being done through request for proposal, which is RFP mechanism. In addition to above short-term training, Directorate General of Training under MSDE is implementing long-duration vocational courses through industrial training institutes with an objective to provide skilled workforce to the country as well as the industry and for self-employment of youth. And now let's move on to the next question, and this one is also to the Ministry of Skill Development and Entrepreneurship. And this one has been asked by member Kirodi Lal Meena, and the member has asked whether the government proposes to set up International Skill Development Center in India.
Well, the reply to this query was given by Minister of State for Skill Development, R.K. Singh. In the reply, the ministry says in order to facilitate international workforce mobility on 11th of February 2020, National Skills Development Corporation launched India International Skills Center Network. The India International Skills Center Network is a nodal platform to facilitate international workforce mobility opportunities for Indians. It's a fee-based, market-driven model determined by global workforce supply and demand dynamics. It comprises of member organizations involved in activities related to overseas workforce mobility like incremental skill training on international standards or testing assessment of skills for overseas employment, operating through several fixed centers called as IISCs. Through IISC networks, member organizations are supported to work across various country clusters. Now, these include Gulf Cooperation Council, Japan, Russia, Southeast Asia, North America, Australia, New Zealand, and Europe. The NSDC provides access to several benefits to members of the network. These include knowledge and research to facilitate international workforce mobility, government-to-government, business-to-business facilitation, international skill standard benchmarking and harmonization, advocacy and branding, international workforce facilitation, Employer Connect, funding support, candidate and business loans, international assessment centers, technological support through IT platform, data management and monitoring system. As on January 2021, 95 organizations are part of network operating through 537 IISCs across more than 240 districts in the country. The government has taken several initiatives to provide employment opportunity to youth abroad by signing Memorandum of Understanding, Memorandum of Cooperation with various countries such as Germany, Japan, Switzerland, UAE, Qatar, Belarus, UK and France. Well, moving on to the last question of this edition of the show that was asked by member Bikash Ranjan from Ministry of Rural Development. The member asked about the status and how effectively Sansad Gram Abhiyan Yojana has been implemented.
Well, this response has been given by Rural Development Minister Narendra Singh Tomar. He goes on to say that members of parliament have identified 1,960 gram panchayats under Sansad Adarsh Gram Yojana till 8th of February 2021 since the beginning of the initiative. The gram panchayats adopted under this scheme prepare village development plans through a participatory process under the guidance of honourable members of parliament. The VDP includes prioritised time-bound activities to achieve holistic progress of the village. So far, 1,565 gram panchayats have uploaded their VDP containing 76,776 projects as per the data available on the website. Out of these, 48,561, which is 63% of the projects, have been completed as on 8th of February 2021. Under this framework, the development of gram panchayats is envisaged through convergence and implementation of existing government schemes and programs under the administrative control of respective ministries without allocating additional funds. Further, the third-party evaluation of gram panchayats by 9 central universities has indicated that the components covered under the scheme and the activities proposed were very much relevant in overall development of villages.
Well, that's it in this edition of Question Hour. Thanks for watching our show, and you can also catch all our programs on the online platform of YouTube and Twitter.
Thanks for watching. Stay safe, stay tuned. Goodbye.